Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, let's dive into a huge dilemma in heart health. We're talking about high cholesterol and what happens when the go-to treatment, well, when it just creates a whole new set of problems for literally millions of people. I mean, imagine this. It's a super frustrating situation, right? You know you've got to get that cholesterol down to protect your heart. But the number one tool in the toolbox, statins, just isn't an option for you. So where do you go from there? And look, this is not some tiny niche issue. We're talking about a huge number of people. According to the New England Journal of Medicine, a really big deal in the medical world, somewhere between 7 and 29% of patients report side effects. Most of the time, it's muscle pain, and it's bad enough that they have to stop taking the medication altogether. That right there, that's the scale with this dilemma. Now, let's be super clear about something. For most people, statins are absolute lifesavers. They are incredibly safe and effective. I mean, they're the undisputed cornerstone of preventing heart attacks and strokes. But for that sizable group of people who can't take them, it's a massive challenge. Okay, so let's dig into this. How can one drug be such a game changer for so many, but a total deal breaker for others? Let's unpack it. So what are we actually talking about when we say statin intolerance? You know, this isn't just a little ache or pain. We're talking about side effects so significant that they make you stop a treatment that could literally be saving your life. That's the official clinical definition. So why does this happen? Well, one big reason is that not all statins are created equal. You've got some that are lipophilic, basically they're fat-soluble, and because of that, they're more likely to get into your muscle cells and cause problems. Then you have others that are hydrophilic, they're water-soluble, and those tend to be tolerated a lot better. So a doctor's first move is often to just switch you to a different kind. But for a lot of people, even that doesn't fix the issue. And you've got to understand, the stakes here are incredibly high. This is really the whole point. When someone stops taking their statin, their risk of having a major event, we're talking heart attack, stroke, it shoots right back up. It's this awful trade-off between feeling bad now from the side effects or risking something catastrophic later. Nobody should have to make that choice. So, okay, how does a doctor figure out if the statin is really the culprit? Well, as you're about to see, it's not simple. For patients, it can be a really long, really complex journey to get an answer. Just take a look at this. This flowchart. This is the official way doctors are supposed to diagnose statin intolerance. It's this whole process of stopping the drug, waiting to see if you feel better, then starting it again, maybe at a different dose, or trying a whole new statin. You can just see how long and frustrating this would be for both the doctor and the patient. It just screams out for a simpler solution, doesn't it? And the good news is that better way forward might finally be here. It comes from a huge landmark study called the Clear Outcomes Trial. And for these patients, it offers some very real hope. So the star of this trial is a new drug. It's called bempedoic acid. And what's cool about it is that it's designed from the ground up to lower cholesterol in a totally different way, a way that gets right around that whole problem with muscle side effects. So how does it do that? Okay, think of it like this. It's a key that only works in one specific lock. Bempedoic acid is what's called a prodrug, which is just a fancy way of saying it's inactive when you swallow it. It's just floating around doing nothing. It only gets activated. The key only turns once it gets to the liver. Because it never gets switched on in your muscles, it can do its cholesterol-lowering job without ever causing that muscle pain. It's pretty smart. But of course, the billion-dollar question is, does this clever trick actually prevent heart attacks and strokes? I mean, that's what really matters. So to find out, researchers got a massive group of patients, almost 14,000 people who couldn't take statins, and enrolled them in this huge trial. And the results? Yeah, they were pretty impressive. First off, the drug did exactly what it was supposed to do. It lowered that bad LDL cholesterol by more than 21% compared to the placebo. So, check. But here it is. This is the result that really matters. That drop in cholesterol wasn't just some number on a lab report. No, it translated into a 13% lower risk of having a major cardiovascular event. For the very first time, there was solid proof of an alternative that works for these patients. Let's just break down the raw numbers here. Okay, so in the placebo group, the ones not getting the real drug, 13.3% of them had a heart attack, a stroke, or another major event. Now, look at the bempedoic acid group. That number dropped to 11.7%. That might not sound like a huge leap, but in a study this large, that is a statistically significant difference. It proves this drug saves lives. Okay, so bempedoic acid is a fantastic new tool for a really common problem. But what about the other end of the spectrum? What about patients who have these super rare genetic conditions that cause dangerously off-the-charts high cholesterol? For them, you need something even more powerful. And this is where things get really fascinating. We're moving into the world of truly precision medicine. We're talking about treatments designed to hit the very specific genetic root of a disease. Yeah, we're talking about a condition with a very long name, homozygous familial hypercholesterolemia. Let's just call it HoFH. Basically, people born with HoFH have genetic mutations that cause their cholesterol levels to be sky high right from birth. It puts them at an extreme risk for heart disease, often very early in life. So for these specific patients, there's another amazing breakthrough. It's a drug called ivinacumab. Now, this is a totally different kind of medicine, a monoclonal antibody, and it works in a completely novel way. It targets a specific protein to bring cholesterol down. And here's the key part. It works independently of the cellular machinery that's broken in HoFH patients. That's what makes it a total game changer for them. So we've got these incredible scientific breakthroughs, right? But how does something go from being a cool result in a clinical trial to something your doctor can actually give you? Let's talk about how this science actually becomes the new standard of care. And this is the final piece of the puzzle. The evidence is now so compelling that the big medical organizations, in this case, the European Society of Cardiology, have officially added these new drugs to their treatment guidelines. That's the stamp of approval. That's what takes a drug from being experimental to being an essential tool for doctors. So let's just zoom out. What does all this mean for patients? Well, first, it means statin intolerance is finally being treated as the real, serious medical problem it is, not just something that's all in your head. And even more important, we now have proven, effective alternatives that are officially recommended. This is a huge, huge step toward being able to personalize how we treat high cholesterol. And that leaves us with one last big question to think about. We've seen this journey, right, from having basically one main drug for almost everyone to now having this growing toolkit of specialized treatments for very specific groups of patients. It really makes you wonder, are we watching the end of one-size-fits-all medicine? Is this the future?
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.